Gone are the days of cookie-cutter approaches to mental health with sterile office visits. Today's progressive psychiatric social worker serves on the cutting edge, embracing innovation, and pushing boundaries in the pursuit of holistic wellness. Their toolkit is as diverse as the challenges they face, from therapeutic techniques honed in the trenches to community organizing tactics that shake the foundations of stigma. Psychiatric social workers are catalysts for change, a voice for the voiceless and champions for a brighter, more inclusive tomorrow. What is psychiatric social work? Psychiatric social workers are licensed social workers specializing in supporting individuals facing mental health challenges. They work collaboratively with psychiatrists, therapists, nurses, and other mental health professionals to create holistic treatment plans for patients. Unlike their predecessors who may have focused primarily on institutional care, today's progressive psychiatric social workers embrace innovative approaches and diverse settings. They work in various psychiatry and social work environments, from traditional hospital settings to community clinics, outpatient programs, and even telehealth platforms. The responsibilities of a psychiatry social worker can vary depending on the specific setting they work in. Some core functions include conducting psychosocial and other assessments, treatment planning, crisis intervention, case management, discharge planning, psychotherapy, education, and community outreach. The field of medical and psychiatric social work offers opportunities for specialization, including child and adolescent psychiatry, geriatric psychiatry, substance abuse treatment, and military social work. What qualifications does a psychiatric social worker need? While a bachelor's degree might be okay for entry-level work, if you wish to work more directly helping patients, you should earn a Master of Social Work (MSW) degree. For medical and psychiatric social work that involves providing therapy and treatment plans, it's recommended to earn a Licensed Clinical Social Worker (LCSW) designation. A career as a psychiatric social worker offers the opportunity to make a significant impact on the lives of individuals and families facing mental health challenges. It's a dynamic and rewarding profession that is constantly evolving to meet the changing needs of our society. Are you looking for case management software for psychiatric social workers? Spend less time on administrative tasks and more time with patients. Case Management Hub is a simple-to-use casework software that streamlines many social work tasks. Sign up for a free trial today at socialworkportal.com.